Hello and welcome to this week's Bump Date. My name is Lara Proud. I'm a registered nurse and I'm the owner of Beyond the Bump Education. This week I wanted to discuss one of my absolute top subjects and the best performing post that I have ever made on baby poop. This is one of those topics that every new parent wonders about but doesn't particularly want to ask. So this week we're specifically going to be talking about the transition from birth into the first few days postpartum for your baby and what their poop looks like and what that means. So I have this very handy dandy little prop here. So basically, this is going to show you the size and the color of what it is that you would like your baby's poop to actually look like during those first few days. So this one that you'll see right here, this is a typical color of what is called meconium. Meconium is the very first type of poop that your baby will have, and basically what it is while they are still in utero, your baby is actually still making waste. So hopefully baby has actually waited until they are born to be able to have their first bowel movement. It doesn't always happen like that sometimes, as was the case with my own son, but it is the case for a lot of people. So what you'll find, this is actually a breakdown of the red blood cells. This is a breakdown of kind of that extra body waste that your placenta has not carried away through pregnancy. One of the things that you'll find is when you are breastfeeding colostrum, in that first few days before your full milk supply comes in, you may or may not feel like baby is getting a ton. You might be able to express a few drops, but I want you to know that as long as baby is peeing and pooping appropriately, has a good latch, is actually going to be feeding for a decent amount of time, and there's no other concerns that you have, then typically the progress is going to look a little bit like this. So they go from this really dark, tarry, sticky meconium through into the transitional stool, which is a little bit kind of like flecky. It gets a little bit more greenish colored sometimes. Sometimes it gets a little bit more browny colored. But it will lighten up. So this is another kind of one that you would expect a few days in, maybe on day 2, day 3. And then this is the type of color that you would be looking at for stool for a breastfed baby. So you're going to find it could be like a dark yellow, going to be turning into kind of a lighter yellow color, has kind of these little seeds in it. They call it seedy poop. With breastfed babies, this is really, really common. It's just byproduct of the milk and how the milk changes and the really high fat content. It's a totally normal thing to see. In formula fed babies, what you might actually find is that it may not be so much this light yellow color. It may not be seedy. It could be a little bit closer to this orangey or even this tan colored. This is normal. This is because of the way that formula is actually digested. It's something that happens through pretty much every baby who is actually formula fed, and it's just because of the consistency and because of the different pieces of the formula not being digested and sort of that process that it goes with. So I hope that this explains just a little bit about what it is that you will see. This is a pretty decent guide for color, but it's also a decent guide for the size of poop that you are hoping for. So you're hoping for like probably a couple inches, maybe 3 to 4 centimeters in a poop. And that is considered to be like a really good poop. Sometimes that you may find they have like a little streak in the diaper. Not too awful much of anything else going on, but if you are finding that baby is having a couple of good sized bowel movements in those first few days, that's a really good thing. One of the things that it's going to help prevent is an increase in jaundice. So you may notice that some babies do have this kind of yellowy tinge to them. You may notice it in their eyes a little bit. This is considered jaundice. You will be aware of it from your provider at this point. What you will find is that you will either be treated with a light therapy or they may just want you to watch it. It could be an increase in topping up with fluids because basically what it is, either breast milk or formula, is the key and the answer to solving this problem of jaundice. The only way to get that bilirubin, which is what's causing the yellow, out of the system is to actually poop it out. So having these bowel movements frequently, especially in those first few days, are going to be really, really good. Every baby is going to have a schedule a little bit on their own. Some babies will poop a whole bunch. Every single time that they feed, they may have a bowel movement. Every time that they are getting changed, there's no rhyme or reason. Some are less frequent, some are more frequent. So what you want to see is within the first 1 to 2 days, you're having about 1 to 2 dirty diapers a day. Now, from day 3 onward, this is where it's going to vary a lot per child, but you want to be seeing at least 3 different stools, so 3 different bowel movements in that day period from day 3 onwards. Now, this is going to be a little bit different for baby P, which you're going to be expecting day 1 and 2, at least 1 to 2 P diapers, day 3, 3 diapers, day 4, 4 diapers, and then from day 5 to 7, you're going to be expecting or hoping for at least 6 wet diapers every day from there on out. One of the absolute best signs, knowing whether or not your baby is getting enough, especially people who are breastfeeding, because they worry a lot about that, is to know if your baby is having adequate output. So head over to the post on Instagram that I have linked here. It gives a really great visual on what to expect and how much to expect for baby's first poops. Everything that you kind of need to know in those first few days about what to expect. I hope this was helpful. Have a wonderful week and we'll see you next week.